Joining me from the prestigious University of Nebraska Medical Center is Dr. Ted Cieslak, a well-known infectious disease expert. Dr. Cieslak, thank you so much for coming on the broadcast. Can you tell us more about the potential of the antiviral drug called remdesivir in treating coronavirus? My understanding is that some medical experts say it's the best hope for treating the virus, and we understand testing right now is going on at the University of Nebraska Medical Center among parents. How are those tests going, and will we have any definitive answers about its effectiveness?
Well, thanks, George, for having me here. You are correct. We are conducting a trial of remdesivir versus placebo. It's a randomized trial that patients are offered if they're sick enough to need therapy at all. Remdesivir, we have some reasons to think that it might be effective. It's a drug that we've known about for a while. It was tried against Ebola during the outbreak going on in the Democratic Republic of Congo. And fortunately or unfortunately, depending on your perspective, there were a couple of drugs that proved far more efficacious than remdesivir against Ebola. And so it was dropped for that reason, but we're optimistic that it may have some role against this coronavirus. We won't know the answer to that because with any unstudied drug, there's an equal potential that it could be problematic. And so doing a randomized trial is the only way to sort that out. And we suspect it'll be quite a while yet before we have definitive results from that trial. But it offers us some hope.
Sure. Dr. Cieslak, on that point, real quickly, if the trials for the remdesivir go well, when do you think it'll be available on a large scale to hospitals nationwide? And is it only given intravenously, by the way?
Yes, so right now it's an intravenous drug, and that obviously poses some problems, much more difficult to use it on a wide scale than an oral drug would be, for example. But I think it will be many months, if not a year, before remdesivir would get through the regulatory process. Typically, when we license a drug, it goes through 3 phases of clinical trials. So that often takes a year to a year and a half.
Yeah, a lot of people are asking the question, is this a virus that will go away in the springtime? And if so, could it come back next year? In other words, do we see this virus becoming seasonal?
Well, I like to hope for the best and prepare for the worst. And so I think the best case scenario, we hope that springtime and summer will help us with abatement of this viral infection. But I think we have to plan for the opposite. We right now don't have good evidence that it will go away. It's obviously causing outbreaks in nations like Singapore, which are humid tropical climates where it's warm already. So that gives us a little reason for pause. But we hope Mother Nature will give us a little help in that regard. If it does go away in the summer or declines in incidence, we do fear that it will come back. And in fact, I think that speaks to a lot of our strategy right now. So I'm sure some of your viewers are probably thinking, well, the horse is out of the barn. This is sweeping the globe. And there's some truth to that. And we may not be able to stop this outbreak in its tracks. But if we can flatten the curve, so to speak, if we can spread out the infections over a longer period of time, then I think, first of all, we can prevent ourselves from running out of hospital beds, of intensive care beds, of ventilators, of masks, and equally importantly, we can buy some time for these remdesivir trials and vaccine trials.
Absolutely. We will have to leave it right there. Thank you so much, Dr. Cieslak. Dr. Ted Cieslak with the prestigious University of Nebraska Medical Center. Thank you, and I hope you can come back on the show